exposure, and very soon we are going to finalize, and I'm sure this is going to give a big impetus to the startups who are coming up with innovative solutions to try, test the product and roll it as a regular product in times to come. I would also talk about parametric insurance products, innovative add-ons like covering out-of-pocket expenses, and we are all aware, and we keep debating out-of-pocket expenses is more than 60-65% as far as India is concerned. Now, I wonder why can't we come up with a product with the help of technology? There is a concern around fraudulent claims and all that, but I'm sure that technology can be the answer. And insurance companies should be enthused because that's a huge market, and that will bring a lot of relief to a lot of citizens across the country. Can we provide the cover for the OPD? Can we think of providing cover for some treatments which are currently under exclusion in the present environment? Can we think of enhancing the distribution efficiencies? The important thing that we need to bear in mind is I would like to talk about the 3 A's of insurance: insurance awareness, insurance accessibility, and insurance affordability. And in this conference and this, the whole day, I think there are a number of other sessions should come out with some kind of roadmap. How do we reinforce the trust of the policyholders? I was just mentioning, as Tapan mentioned, that as a citizen, when I'm already ill, I have to be hospitalized, I am the breadwinner for the family, and when I'm walking into the hospital, there is an anxiety in my mind and the family. Pata nahi yaar kitna paisa milega, fir jeb se kitna dena hoga. How do we make? I'm picked up from my home and I'm brought back to my home after the surgery or the procedure is over, and then I get a call. Sir, how are you? One from the hospital, one from the insurance company. So that is the wow factor and the delight factor, and the trust of insurance as a product will get reinforced. It doesn't matter to him. You are charging him 100 rupees as premium, say for example, if you charge another 10 rupees. It's not going to make a difference, but the experience will be a different. How can we come up with those kind of products? I'll come for the insurance sector is insurance for all. And when I say insurance, it's only not restricted to health insurance. It extends to life insurance. No Indian should die without a life cover. No Indian should die for not having a health cover. Property insurance, personal accident insurance, these are all very important risk mitigation tools, particularly for those sections of the society who are vulnerable and who are at the bottom of the pyramid as far as development is concerned. Now, opportunities are huge. Why are we not able to tap them? We all know, we all debate that there is a huge insurance market for the health insurance sector, but still we are not able to tap them. Now today, India is digital India and pioneering in digital inclusion. More than 65 crore people are having access to internet. And we are all aware the kind of digital transactions which is happening in the payment systems. 840 crore digital transactions amounting to 3,200 lakh crore took place only in financial year 21-22. Now, in such a scenario, how can we leverage the technology platform in health insurance space and in all kinds of, right from selling, settling, servicing, all of the 3. Now, our lack of tie-ups with hospital proving obstacles in the accessibility of insurance service to the policyholders is a question mark. We have recently facilitated insurers to have tie-up with hospitals, meeting standards and benchmarks criteria as specified by the boards. So the stipulation of you have to have certification from X, Y, Z have been removed, particularly, and leaving it to the boards to apply their minds so that you will panel those hospitals which have the minimum requirement. So rather than me prescribing X, Y, Z, we are asking the boards of the insurance companies to decide that. And that's primarily with the aim of not depriving people who live in the tier 2 below cities. If there is a hospital meeting those benchmarks with the minimum requisite infrastructure and the manpower, they can go ahead and empanel there. As part of our initiatives on regulatory reforms, we are also amending the regulations on the sandbox, and you are all aware of the regulatory sandbox mechanism, which actually provides the scope for innovation and experimentation. On ground, actually, you try and work out that solution. If that becomes successful, then we allow you to roll out similar products in a continued manner. So there were some bottlenecks in the regulatory sandbox mechanism, which we have now revamped. It's there in public and its importance. The Insurance Act of 1938 was amended in 2015, and health insurance was recognized as a separate vertical in the insurance industry. I think that was the turning point when health insurance has gained a lot of importance since then. Insurers who provide specialized health insurance products started getting registered with our IRDAI, and as on date we have 6 standalone health insurance companies in addition to the general insurance companies, which are 25 in number, who are offering benefit-based products, who are offering all kinds of healthcare products, insurance products, along with the 24 life insurance companies who are also selling certain benefit-based products. Now, to facilitate the hassle-free claim settlement process, we also have a network of around 19 third-party administrators. But I would say that this is not enough for the size and the kind of diversity in our population as far as India is concerned. The point I am trying to make is that we need many more players to reach out to the length and breadth of the country. We need more service providers. We need to look at the intermediaries or the distribution channels who are selling the product. So all of this has to be looked into. The health insurance market in India has grown, I think, at a 19% CAGR over the last 5 years. But that's not enough. I think we need to grow at 35-40% CAGR if we have to enhance the insurance density in this country. In terms of premium collected, it has grown from 20,000 crore around 2014-15 to 73,000 crore in 21-22. Now, as seen from the latest statistics on health insurance, you'll find that around 29 crores of lives have been covered during FY 21-22, and around 50 crore lives have been covered under the government's flagship program, the Ayushman Bharat. In addition, perhaps around 14 crore more lives estimated to have been covered under the other social insurance schemes like the ESIC and the CGHS. But there is a huge market, I think one of my colleagues just mentioned, which is untapped, and there is a large section of the population which is missing the facilities of financial aid that health insurance can provide. And about 30% of the eligible population is the missing middle. If I can say, they are deprived of the health insurance cover. Now, what could be the possible reasons? It is time to ponder. Now, as we march towards achieving our vision, that at 100 years, when we turn 100, the goal for the
enabler for development of the nation. We cannot have world-class education system in 2047. It has to happen much earlier, so that it propels, it energizes, it powers that achievement that we are referring to. Therefore, I agree with you. Let's work together. This is a recurring thought. The breakthrough again in this regard has not happened. At some stage the conversation used to be, प्रायोरिटी लैंडिंग को बढ़ा दीजिए, वो बढ़ गई फिर भी कुछ नहीं हुआ. सर वो स्कीम लेके आ गए, खास कुछ नहीं हुआ. हमने पीपीपी स्कीम बनाई नीति में, इतना सा कहाँ रुके? कोई रास्ता निकल सकता है हेल्थ इंफ्रास्ट्रक्चर को बढ़ाने का. And then through assurance and assuring mechanism, we are all then connected into one health system. Rational pricing, access of everybody. That is already happening since the time Ayushman Bharat was launched. It connected the government and the private sector on a scale which was well above what was happening in a fragmented way in the state. So we are one sector. लेकिन पब्लिक सेक्टर में देखिए मेडिकल कॉलेजेस बढ़ गए, 157 हो गए और आ जाए, डिस्ट्रिक्ट्स आर बीइंग स्ट्रेंथेंड, क्रिटिकल केयर यूनिट्स आर बीइंग बिल्ट, मदर चाइल्ड ब्लॉक्स आर कम. इस तरफ इतना कुछ हो रहा है, प्राइवेट सेक्टर में क्या वो स्पीड है नहीं, इसको कैसे बढ़ाया जाए to make it into a win-win situation. And then what kind of private sector hospitals are required? Perhaps that also needs a research. The ones that work on high volume and modest where frills and the freebies can be handled in a certain way. And go for quality care, quality standardized care. That is the way forward. And let's see how together we can create a blueprint for developing such a health sector in the private space or the PPP space to work together. So 3 takeaways, 3 points the way forward. 1, an aspirational, workable product for the missing middle and more in that space before December 2022. Second, bringing in transparency and visibility of our care that we give so that people know what they are in for and more. And the third, how we can catapult the creation of private healthcare space for India in the service of people of India. At the beginning of the Amrit Kaal, the phase that we have entered, I hope if we work on these 3, we will feel protection. It's also a moment where you would like to solve this problem sooner than later. Post-COVID is a situation where economies are being reimagined. Agriculture is being reimagined. Industry is being reimagined. Health sector, of course, is being reimagined, as well as the insurance sector. So again, look upon this as an opportunity. And I think we have to deliver it for people of India. Let's admit it, the big development in the last many years has been the Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat, in this space. And you're aware that it is a scheme which is covering potentially half a billion people. But I'm also happy to let you know that when you add the additional coverage provided to additional citizens of several states, it actually is something like 65 crore to 67 crore people potentially covered. 3.56 crore hospitalizations have been covered. 42,000 crore money has been disbursed. This could have been upon people, but has been provided for from the system, the state and the union governments. 3.56 crore hospitalizations, as I said, have taken place. But when we look at the debate that's been going on in the last 10 years or more, the need for private insurance has been felt, but we haven't really offered a tangible solution or a set of solutions. So I come here also to tell you that we are somewhat delayed. We haven't offered a product that could go in line with PMJ or aligned with PMJ and more. We talked about missing middle way back in 2018, 40 crore people not covered. This number may be even bigger, perhaps 30% of India not covered at that time, and it remains so. We together have not been in a position to offer a tangible product, and I think that field should also propel us to do more and more quickly. I carry that field. Why is it that a set of products could not come up? I think there was a product called Ayogn Sanjeevani. I don't know what happened to that. That was somewhat close to the paradigm that Niti has presented. So I think let's be responsible in delivering choice of product or products to the people of India. We have seen one thing. I want to say this in the presence of the leadership here. कुछ करना पड़े. हुआ नहीं. 2 साल एक difficult time था, चलो छोड़ते हैं. क्या हम अब लग जाएं इसको? And there, Debasish Panda ji's guidance to you is a help. And let's build on that and let's use the opportunity. So that's my first way forward. Let's go for creating the right products. There isn't a product which has been found attractive to the population of concern that really that particular population which can afford, but is not coming forward and not getting opportunities. तो एक वे फॉरवर्ड हमारा क्लियरली है, इस काम को दिसंबर से पहले करना है। हम सब मिलके करेंगे, अपनी टीम में नीति को जोड़ लीजिए और नीति की टीम में आप जुड़ जाइए। हम सब जैसे सर ने कहा अभी, we are all together in this journey, in this mission. So before December 2022, sir, let's join hands and offer tangible, workable products which embrace the principle that you laid out and also the other speakers laid out, so that there is progress, a clear progress, and let that be aligned with the larger initiative of Ayushman Bharat and of course the other initiatives such as the ESI. So that's my first request for way forward. And while we do that, there's a caveat here. We talked about 2.7 lakh people covered for COVID, I guess, 24,000 crore disbursed. Think about it. It was a pandemic which caused illness to all of us. This is minuscule. By the way, this is absolutely minuscule for a nation of our size. What is it that we have covered? Looks good in terms of lakhs. We didn't cover very much, and that's not surprising, by the way, because the coverage itself has been low. So let's also, we can say we did a good job, but I don't think we met the expectation of the people in this regard. And then let's remember also